Take a slow breath right now and notice something. Notice how easy it is. Now picture climbing one short flight of stairs, the kind you have climbed 1,000 times in your life, and imagine reaching the top and having to stop and hold the railing because your chest feels tight and the air just will not come fast enough. That single moment, that little pause on the stairs, is one of the earliest whispers your heart can give you when it is starting to grow weak. It is not loud. It does not knock you to the floor. It is quiet and easy to explain away. And that is exactly why so many people miss it. A weakening heart almost never announces itself with a single dramatic moment. Long before anything serious happens, your body begins to hang little signs in the window, on your legs, on your lips, in your breath, even on your bathroom scale. The American Heart Association teaches that the most common warning signs of a failing heart are shortness of breath, unusual fatigue, and a buildup of fluid in the body. These are not rare or mysterious symptoms. They are common, they are visible, and most of them can show up weeks or even months before a crisis. Today I am going to walk you through 8 of them, the ones you can actually notice on your own body, so that you can catch trouble early, while there is still so much that can be done. I am Dr. Daniel Mercer. For more than 18 years I have practiced internal medicine, and I have spent a great deal of that time sitting with people over 60, looking closely at the small signs the body gives off long before a diagnosis is ever written down. The body is honest. It tells the truth in its own quiet language, on the skin, in the legs, in the way you breathe. My whole purpose on this channel is to help you read that language, so you can act early instead of late. So please, settle in, relax your shoulders, and stay with me, because every one of these 8 signs is something you can check today. Before we go on, if you find it helpful to have a doctor explain these things slowly and in plain words, take 1 second to like this video and subscribe. It genuinely helps me reach more people your age who deserve to understand their own bodies. That is the only favor I will ask. And now, let us get to work. Let me tell you about a man I will call Frank. Frank was 71, a retired postal carrier, the kind of man who had walked miles every day for decades and was quietly proud of how strong his legs still were. He came to see me not about his heart at all, but because his shoes had started feeling tight by the end of the day. He thought he was simply on his feet too much, but when I pressed my thumb gently against his ankle, the skin held the dent for several seconds before slowly filling back in. That little dent, and the story behind it, told me his heart was beginning to struggle. When I asked Frank a few more gentle questions, the rest of the picture quietly filled in. Yes, he had been waking once or twice a night feeling a little short of breath. Yes, he had drifted into sleeping on an extra pillow without ever deciding to. Yes, the stairs to his bedroom had started to feel longer than they used to. None of it had alarmed him, because each piece on its own seemed so ordinary, so easy to explain away as simply getting older. Frank had no idea his heart was the thread tying it all together. He felt mostly fine, and because we caught it early, while it was still just a whisper instead of a shout, we were able to help him in ways that would have been far harder and far more frightening a year later. He is still walking his neighborhood today. I want you to have that same head start, so let us walk through the 8 signs together, slowly and clearly. The first sign, and often the very earliest, is shortness of breath that shows up when it never used to. I want you to think about whether anything has quietly changed in your breathing. Maybe you used to carry the groceries in from the car without a thought, and now you find yourself setting the bags down halfway to catch your breath. Maybe you used to make the bed without stopping, and now you pause partway through. Here is why this happens. When the heart muscle weakens, it cannot push blood forward as briskly as it should, so blood and fluid begin to back up into the lungs. Picture a kitchen sink with a drain that is starting to clog. The water does not rush down the way it used to. It pools and rises. When fluid pools in your lungs, there is less room for air, and so you feel winded doing things that never used to wind you. This is one of the most important early signs there is, and it is so easy to blame on age or being out of shape. Please do not brush it aside. The second sign is a close cousin of the first, and it is one of the clearest of all. It is breathlessness when you lie down flat in bed. Many of my patients tell me, almost as an afterthought, that they have started sleeping propped up on 2 or 3 pillows because lying flat makes them feel like they cannot get a full breath. Some wake up suddenly in the night, an hour or 2 after falling asleep, feeling like they need to sit up and gulp the air. This happens because when you lie down, All that fluid that had settled in your legs during the day redistributes and washes back toward your chest and lungs. A healthy heart handles it easily. A weakening heart cannot. So if you have quietly added pillows, or if you sleep better in your recliner than in your own bed, that is your heart talking to you. The third sign is swelling in the legs, the ankles, and the feet. Doctors call this edema, and it was the very thing that brought Frank to my office. When the heart cannot keep blood moving forward with enough force, fluid leaks out and gathers in the lowest parts of the body, pulled down by gravity. That means your ankles, your feet, and the lower part of your legs. Here is a simple check you can do right now, sitting where you are. Press your thumb firmly against the front of your shin or the top of your foot. Hold it for about 5 seconds, and then lift it away. If a dent stays behind, a little pit that fills back in slowly, that is called pitting edema, and it is one of the most reliable visible signs that fluid is building up. Watch for socks that leave deep marks, shoes that feel tight by evening, or one leg looking puffier than the other. The fourth sign is one that almost everybody overlooks, and it may be the most useful of all, because it gives you a number you can track. It is sudden weight gain over just a few days. Now this is not the slow weight change that comes from eating a bit more. This is fast, and it comes from fluid, not fat. The American Heart Association tells patients to watch their weight closely, and to call their doctor if they gain more than 2 or 3 pounds in a single day, or more than 5 pounds in a week. Think about that. A heart growing weaker can cause you to hold several pounds of fluid in just a few days. This is why I tell so many of my older patients to keep a simple bathroom scale and step on it at the same time each morning, after using the bathroom, before breakfast, warning about the same thing. That number is one of the earliest and most honest warnings your body can give you, long before you ever feel truly ill. The fifth sign is a persistent cough or a wheeze that simply will not go away. This one fools people constantly, because we naturally assume a cough means a cold, or allergies, or something in the lungs. But when the heart is weakening and fluid is gathering in the lungs, it can cause a dry, nagging cough that lingers for weeks. Often it is worse at night, or worse when you lie down, for the same reason the breathlessness is. Some people cough up a frothy or slightly pink-tinged mucus. If you have a cough that has hung on far longer than any normal cold should, especially if it comes with any of the other signs we are discussing, your heart deserves to be part of the conversation, not just your lungs. The sixth sign is deep, unusual fatigue, a tiredness that rest does not seem to fix. I want to be careful here, because everyone feels tired sometimes, and being tired by itself does not mean your heart is failing. But the fatigue of a weakening heart has a particular flavor. When the heart cannot pump enough blood to meet the body's needs, it quietly reroutes what blood it has toward the most vital organs, the brain and the heart itself, and away from your arms and legs and muscles. So your limbs feel heavy. Ordinary tasks feel like wading through water. People tell me they had to sit down halfway through cooking dinner, or that they no longer have the energy for the hobbies and the walks they used to love. If a bone-deep tiredness has crept into your days and stolen things you used to enjoy, that is worth paying attention to. The seventh sign is one you can see in the mirror, and it is important. It is a bluish or grayish tint to your lips, or to your fingertips and nail beds. Doctors call this cyanosis. Healthy blood that is rich with oxygen is bright red, and it gives your lips and fingertips a healthy pink color. But when the heart and lungs are struggling to move enough oxygen, the blood carries less of it, and the skin in those thin-skinned places can take on a faint blue or dusky gray cast. Look at your lips and your fingertips in good natural light. If they look bluish or gray when you are not cold, that is a sign your body is not getting the oxygen it needs, and it is one you should never ignore. The eighth sign is a feeling of fullness or swelling in your belly, often paired with a loss of appetite. This surprises people, because we do not usually connect the stomach with the heart. But when a weakening heart lets fluid back up, that fluid does not only settle in the legs, it can also gather around the liver, the stomach, and the intestines. This can leave you feeling bloated, uncomfortably full after only a few bites, or simply not hungry at all. Some people notice their waistband growing snug even though they have not been eating more. If your belly feels swollen and your appetite has quietly faded, that fullness may be fluid, and fluid is a message from your heart. So those are the 8 signs: shortness of breath with ordinary activity, breathlessness when you lie down flat, swelling in the legs, ankles, and feet, sudden weight gain from fluid, a lingering cough or wheeze, deep fatigue that rest will not fix, a bluish tint to the lips or fingertips, and a swollen, full belly with little appetite. Notice the thread that runs through almost all of them. It is fluid. A weakening heart cannot keep fluid moving the way it should, and that fluid shows up in your lungs, your legs, your belly, and on your scale. Once you understand that one idea, all 8 signs start to make simple sense. Now I need to draw a very clear line for you, and this part matters more than anything else I will say today, so please listen closely. The 8 signs we just covered tend to build slowly, over days and weeks. They are early whispers, and they give you time to act. But there is a different kind of warning that is not a whisper at all. It is an emergency, and it demands that you act in minutes, not days. If you ever feel pressure, squeezing, tightness, or pain in the center of your chest, especially if it spreads to your arm, your jaw, your neck, or your back, or if it comes with a cold sweat, sudden severe shortness of breath, nausea, or a feeling of doom, do not wait. Do not drive yourself. Do not tell yourself it is indigestion and lie down. Call emergency services right away. Here in the United States, that means calling 911. Chest pain is never a sign to watch and wait on. It is a sign to call for help immediately, because with the heart, the minutes truly matter. Now let me give you the gentle, sensible part, the safety guidance on what to do with everything you have learned. None of these 8 signs proves on its own that your heart is failing. Many of them have other, more innocent explanations. Swollen ankles can come from sitting too long or from certain medications. A cough can be a simple cold. Fatigue can come from poor sleep. So please do not panic if you notice one of these. Instead, do this. If you notice one of these signs lingering, or if you notice 2 or 3 of them appearing together, make an appointment to see your own doctor and tell them plainly what you have observed. The signs matter most when they cluster, when a few of them quietly show up at the same time, because that pattern is harder to explain away as anything else. Your doctor can listen to your heart and lungs, check for fluid, and order simple, painless tests that give a clear answer. There is real comfort in knowing instead of lying awake wondering. And please remember, never stop or change any medication on your own. Bring what you have noticed to your doctor and let them guide you. This video is here to help you notice, not to replace the person who knows your body. Here is the one habit I would love for you to take from today, because it is so simple and so powerful. Buy an inexpensive bathroom scale and weigh yourself at the same time every morning, right after you use the bathroom and before you eat. Write the number down in a small notebook or on a calendar by the door. Most people will not need to do anything with it on most days. But if you ever see that number jump by 2 or 3 pounds in a day or 5 pounds in a week, you will have caught a warning that your own body was trying to send, and you can call your doctor before it ever becomes a crisis. That little notebook can be one of the most powerful heart tools in your whole house. And here is a small bonus that stacks right on top of that habit. Each morning, when you step off the scale, take 10 seconds to do a quick body check. Glance at your ankles. Are they more swollen than usual? Look at your lips and fingertips in the light. Is the color good and pink? Notice your breathing. Did you sleep flat last night, or did you need extra pillows? It takes only a few seconds, but doing it every morning means you will spot a change early, while it is still small and easy to address. The scale gives you a number, and the quick body check gives you the picture. Together, they make you the very first person to know when something is shifting. So let us bring it all together. Your heart rarely fails in a single dramatic instant. It sends out quiet, early signals, and almost all of them come down to one thing: fluid that is no longer moving the way it should. Watch for breathlessness with simple activity and when you lie down. Watch for swelling in your legs and a sudden jump on the scale. Watch for a stubborn cough, a deep fatigue, a bluish tint to your lips, and a swollen belly with a fading appetite. Notice them early. See them not as a reason to panic, but as a reason to act. Take the gentle steps to your doctor, and always, always treat chest pain as the emergency it is. The whole reason your body gives these signs is to give you time. My deepest hope is that you will use that time well. If this helped you understand your own body a little better, please subscribe and stay with us here. This channel exists to help you stay strong, aware, and independent for many years to come, and it would be my honor to keep walking that road alongside you. Take good care of yourself, look after that heart of yours, and I will see you in the next one. And one last important note before you go. This video is for general educational and informational purposes only, and it is not medical advice. I cannot diagnose you through a screen, and nothing here is meant to replace a conversation with your own qualified healthcare provider. Always speak with your doctor before making any change to your diet, your activity, or your medications. Your doctor knows your body and your history, so bring these signs to them and let them help you use this knowledge safely and wisely.